This adjustment is a seated bimanual grasp, distal forearm hand for a medial to lateral and lateral to medial glide and tilt restriction of the intercarpal joints. When we did our assessment, we challenged tilting, so we also call this ulnar deviation or radial deviation here. And then we did a glide where we sheared, so we took the hand and we sheared it lateral to medial and sheared it medial to lateral. And we're taking those two rows of carpals that exist here and we're gliding them back and forth, or we're tilting and opening them one way or the other. And so the adjustment essentially is that palpation, but we are applying just a little bit more force. Now we're not applying a lot of force here because there's these ligaments that lie on the medial and lateral aspect of the wrist complex that we really don't want to injure. So we need to take our patient to end range, and then once our patient is at end range, we apply just a little bit of extra force as we kind of milk a little bit of extra motion out of those joints. So this is an example of the tilt. And then our glide here, where I'm going to challenge her arm here. This is actually medial to lateral. Remember that anatomical position, it would be this way. So medial to lateral, even though it kind of looks in this picture like it's lateral to medial. We'll apply a force over and then shear that force and glide the hand medial to lateral. So this was a seated bimanual grasp, distal forearm hand for a medial to lateral and lateral to medial glide and tilt restriction of the intercarpal joint.